The next speaker is Dr. Joseph Raymond.
Hello. Please, if you can go to my first slide. Hello, my name is Dr. Joseph Raymond, no conflicts to declare. I'm an emergency physician educated at Cornell Medical School. My residency was Charity Hospital in New Orleans, and I've been working in this region since. Where I work, over 65% of the population are not vaccinated. I'm here today to ask for help for those working the front line to help us reduce vaccine hesitancy. For this, we need larger trials that demonstrate the vaccine reduce hospitalization without finding evidence of serious harm. I know many think the vaccine hesitants are dumb or just misinformed. That's not at all what I've seen. In fact, typically, independent of education level, the vaccine hesitant I've met in the ER are more familiar with vaccine studies and more aware of their own COVID risk than the vaccinated. Next slide, please. For example, many of my nurses have refused the vaccine, despite having seen COVID-19 cause more death and devastation than most people have. I asked them why refuse the vaccine. They tell me while they've seen the firsthand dangers of COVID in the elderly, the obese, diabetics, they think their risk is low. They're not wrong. Next slide, please. One nurse showed me this Oxford risk calculator. A 30-year-old female has about a 1 in 7,000 chance of catching COVID and being hospitalized over 90 days. She asked me, can I assure her that the studies found her risk of serious harm from the vaccine is lower than her risk of hospitalization? The truth is I can't. Our trials weren't big enough. They weren't big enough to identify the vaccines cause myocarditis, yet now we know they do. Next slide, please. A recent observational study suggests the risk of vaccine-induced myocarditis in young males is higher than their risk of hospitalization from COVID. Is this true? We don't know. It's based on observational data. To know it's not true, we need a large trial that proves the vaccines reduce hospitalization more than they cause myocarditis in this age group. Next slide, please. The former FDA commissioner said the original premise of the vaccine was to reduce death and hospitalizations. And that was the data that came out of the initial clinical trials. Except, as you all know very well, and unfortunately, so did my nurse, the initial clinical trials did not find a reduction in death or hospitalization, likely because they were inadequately powered. Yet the former commissioner is correct that the initial trials should have been powered to find a reduction in hospitalization. Next slide, please. We need your help on the front lines to stop vaccine hesitancy. Demand the booster trials are large enough to find a reduction in hospitalization. Without this data, we, the medical establishment, cannot confidently call out anti-COVID vaccine activists who publicly claim the vaccines harm more than they save, especially in the young and healthy. The fact that we do not have the clinical evidence to say these activists are wrong should terrify us all. Thank you. Next slide.
Biden wants to inoculate as many people as possible. So you have to get an annual shot. I mean, it hasn't been formally announced yet. They don't want to rile everyone up. The drug companies, the food companies, the vaccine companies, they pay us hundreds of millions of dollars a year to hire and keep the reviewers to approve their products. If they can get every person required at an annual vaccine, that is a recurring return of money going into their company. I mean, just from everything I've heard, they're not going to not approve it.
Meet Christopher Cole, an executive officer at the FDA with over 20 years' experience who claims to be directly involved in the approval process of the various COVID vaccines. What you're about to witness raises some alarming concerns, from the government's desire to mandate an annual vaccine for everyone, including young children, to the billions of dollars that exchange hands between our government and Big Pharma to railroad the approval process.
I'm a manager for the Food and Drug Administration. My agency oversees vaccines, vaccine approvals, and devices for vaccines. And my office clears all the emergency approvals. Because since COVID is under an emergency order, we expedite the approval of any emergency. I've been there for like 22 years. Biden wants to inoculate as many people as possible. So you have to get an annual shot. I mean, it hasn't been formally announced yet because they don't want to rile everyone up. So,
is it going to be formally announced?
Yeah, at some point. I mean, it's going to be, and some of it's been talked about publicly, but it hasn't been talked about on like CNN or Fox or MSNBC or anything. But yeah, you'll have to get an annual. I think what's going to happen is it's going to be a gradual thing. Schools are going to mandate it.
Why do they need the third one?
Well, the same reason that you or I would need the third one, because the vaccine it wanes.
Mm-hmm.
Your ability to fight it wanes. So the 3 will bolster your system, and then there will be an annual, eventually an annual, just like the flu shot.
For the toddlers?
Well, for everyone.
Okay, so the toddlers too then. We'll have to get it
Probably.
annually. Okay.
I mean,
Yeah.
that's in the future. We're not sure.
Mhm.
That might involve more studies.
The FDA was scheduled to meet this week to discuss approval of the Pfizer vaccine for children as young as 6 months old. They were hoping to have the new vaccine available by the end of the month, but the meeting was unexpectedly canceled, citing the need for more testing.
You guys have been in the news a lot the last couple of days.
Yeah, we're looking at trying to approve. I don't completely agree with the process. They're looking at trying to inoculate kids under 5 years old, between 6 months and 5 years old.
What do you mean you don't agree with the process?
Well, I mean they don't have all the tests aren't there. So I agree with the thing that it is important to inoculate them, but you can't provide the parent as much a surety as you normally want to.
Despite Cole's concerns regarding the possible dangers of vaccinating young children, it seems the FDA is still willing to go through with this approval.
It's an EUA for all age groups, all designations, and then you have to get approved by specific age groups based on the study.
Do you think it's really an emergency for the toddlers?
Well, they're all approved under an emergency, just because it's not as impactful as some of the other approvals, emergency approvals, but they're all being approved under that standard. The efficacy data doesn't have to be as high. The standard is on emergency use authorizations is that it does more benefit than harm.
So how do you know it's already getting approved?
Well, they're not going to, I mean, just from everything I've heard, they're not going to not approve it.
I thought their cases weren't that high for 6 month to 4-year-olds.
They're not, but because it's related to COVID, it's under that approval process.
So how many babies did they have to jab, basically, for the trial?
I don't know. I haven't looked at the trial, how many people they did. There's always a chance of long-term effects, especially with someone younger.
Cole seems certain the federal government will require annual COVID vaccines, including young children, even though the efficacy, adverse reactions, and long-term effects are still unknown.
It's hard to find, like, pregnant women for these studies, and a significant number in order to be statistically accurate. I haven't tested enough on pregnancy, on vaccines and everything, and women, because they have different systems than men. And
They haven't tested enough?
Well, they have, but they haven't done enough prior. Now they've also been very good at promoting that, but that was an issue for a period of time.
Well, I feel like that's still an issue.
It is still an issue. It's still we still haven't gotten there.
I read like a couple articles about it, and everything I saw was that the first 2 shots weren't effective.
There has been, yes, has not been as effective as they're expecting. I agree.
And if all that doesn't raise some eyebrows, just wait until you see what he says in part 2 about the billions of dollars exchanging hands between our government and Big Pharma, and what really goes on behind the scenes during the approval process.
There's almost $1 billion a year going into FDA's budget from the people we regulate. If they can get every person required an annual vaccine, that is a recurring return of money going into their company. It'll be a recurring fountain of revenue. If they can get every person required an annual vaccine, that is a recurring return of money. Help the drug companies, the food companies, the vaccine companies.
So
they pay us hundreds of millions of dollars a year to hire and keep the reviewers to approve their products. Oh, there's a money incentive for Pfizer and the drug companies to promote additional vaccinations.
Like how much money do they get?
Well, I mean, it'll be a recurring fountain of revenue. It might not be that much initially, but it'll be recurring if they can get every person required an annual vaccine. That is a recurring return of money going into their company.
Okay, so like if they mandate it for these toddlers, then
Right,
it's
if the government
guaranteed
mandates it.
income.
Right, at some level.
So do you think that's part of the reason why?
Well, I don't think that's the reason, but that's obviously one of the benefits.
Right.
They clearly want it also for that reason. A long time ago, Congress approved user fees for FDA. Basically, we charge the industry millions of dollars in order to hire more drug reviewers and vaccine reviewers, which will speed up the approval process so they make more money. Like our budget's like,
Excuse me.
it's like $5.5 billion.
Wait, $5.5 billion for what?
FDA's budget. There's almost $1 billion a year going into FDA's budget from the people we regulate.
What do you mean the people? Right.
Well, the drug companies, the food companies, the vaccine companies.
So
They pay us hundreds of millions of dollars a year to hire and keep the reviewers to approve their products. And there's not a direct correlation. I think sometimes the agency whitewashes the impact of the user fees. They tone down the impact of the user fees on their operations because they know they're dependent on the drug companies and the vaccine companies and these other companies for their agency to operate. On the overall impact on approvals, I don't think it has an impact on FDA operations.
okay.
On general, I mean, obviously, there are some people in the agency which might think more favorably on the drug companies that are in the approval process. Well, the dirty stuff is never really publicized. I mean,
Yeah,
obviously
but
there's more
neat.
there's more pressure. There's more pressure to approve something just because it's most of them, well, almost all of them will be based on the actual data. So they're giving more money. Yes, that's great, and it increases the chance of an approval. But if the data's not there, it comes and bites the reviewer in the ass, where they all approve it, and then there's adverse reactions, which we have to pull it off the market.
Does that happen?
This happens. It happens a lot. And all these organizations within FDA, they started to see all this cash in their eyes. It's like, oh, I need to grab some of that. And I think we've gone too far on that. They're getting a little overzealous in charging the user fees to other non-payroll expenses.
Why would they do that?
Well, why not? The money gets banked. It's not spent. It's a multi-year, and the money gets banked there, and you want to be able to spend it
Spend it
on whatever you can, whether it's right or wrong. So then Congress approved it at a smaller level. They approved it mainly for payroll, but then also now it's supporting infrastructure and everything, just like this animal out there. I think it's probably excessive. But industry doesn't want to complain about it too much. But I think FDA is probably, I think they're using it to cover other expenses that don't necessarily tie in with the need of the user fees. I don't think there's enough people saying there, look, that's fine, but that's not right, so we're not going to charge that. You don't want to be that person. You're not going to have a long shelf life in the agency if you're always that person.
always that person that's kind of
Criticizing or suggesting that maybe we shouldn't be doing this.
So if you speak out about it, if you see them,
You're marked.
what do you mean you're marked?
You're not going to get to certain levels. in government. There's not an incentive to speak out in government, surprisingly. You would think there would be, but there's not. It's better just to not say anything and just ignore it. The whistleblower, while it's high profile, the whistleblower statutes and everything, that's kind of ridiculous. There's no protection for someone who speaks up.
Isn't there supposed to be?
There is supposed to be, but like there's easy ways to get around that.
How do you get around it?
Well, you'd be marked from getting other jobs because another office is not going to want to hire you if you've spoken out about something, right or wrong. They don't look at what you've spoken out about. They're just not willing to. Government's about rocking the boat. And they don't want to, which is the problem I have with, one of the problems I have with government is like, they don't like people rocking the boat for right or wrong at all costs. They want to hire a safe person that can do the job, but doesn't necessarily is a great hire.
So the type of person that will turn a blind eye if they see
that's
anything.
That's who they would hire. From what I've heard, and no one's going to hire that person. You're stunned. It's better just to stay quiet and accept it.